So I'll tell John when to change the slide, and you can change it now, John. Thanks. So there are several different orders that we have been working under. As you're aware, March 16th, one of the key orders came from the Santa Clara County Public Health Officer who issued the shelter-in-place order. Then on March 19th, Governor Newsom issued Executive Order N3320, which basically, for the most part, mirrored the Santa Clara County order for shelter-in-place statewide. Earlier on March 12th, I had issued the emergency proclamation, and on March 17th, at your last special meeting, the City Council ratified the emergency proclamation. Next slide. Dr. Sarah Cody, the Santa Clara County Public Health Officer, gave an update today. Currently, there are 375 infected in Santa Clara County. That represents 22% of all cases in California. There have been 16 deaths in Santa Clara County, representing 59% of COVID-19 deaths in the state. She also was very clear to mention that the severity of cases is getting worse. There's also a concern she raised that some of these numbers are probably lagging behind, that some of our information, because of the slowness of the testing, is actually, this may be reflecting numbers that actually were several days ago in some cases. So the county is still trying to catch up at this point. Next slide. So I want to just run through really quickly each of our departments and a little bit about how this is affecting them and some of the things that we're doing at this point. The police department I'll start with, they are maintaining regular staffing levels for patrol. The police will enforce the county and state orders if necessary, but to date, unless something happened today, we have not issued any citations for violations of the order. I do know that our police have spoken with people, kind of issued warnings, reminded them of the order, but to the best of my knowledge, we have not issued citations. We are also starting to review options for some alternate shift deployment in the police department. Our objective here, and this is looking long-term, is to make sure that we always have some of our officers who are essentially protected from any kind of contamination within the police station, so that if one officer became infected, that might impact a few others, but hopefully we keep a lot of our patrol away from the police station for an extended period of time so that they would not be infected. Next slide. Maintenance services, we have reduced staff to approximately 1/2 for each of the different for facilities, parks, streets. The reason for that, again, is to limit the amount of potential contamination among the staff, make them all a little safer, and also that we have a reserve staff. So if something happened, and let's just say one of our facility crew members became infected, obviously anybody working closely with that individual would need to be quarantined, but we would still have people who would not be, and hopefully not infected, be able to come on in and work at that point. In addition, we are following the lead of some other cities, and we have now put our sewer crew on an on-call basis. Sewers, we do have emergencies in that area from time to time. We need to make sure that our sewer crew is ready to respond to such an emergency, and by taking them offline for right now, that will allow us to call them in if it's necessary. Our recreation, let me add also that we have now closed all of our public facilities, the tennis courts, the playgrounds, and all of the bathrooms at our parks. There's like one or two.
Open today, just to let you know.
Okay, it's supposed to be closed now. One or two of the parks do not have doors and cannot be locked up that way. We're looking at some kind of temporary measure to try to keep the public out. For recreation, and I will talk a little bit about their staff later, they have really shifted a lot of their work and are now taking a lead on a lot of our response with the community for the COVID-19 emergency. In the meantime, all of our programs have been canceled. You probably know we canceled the senior programs very early on. But of course, since then, we've canceled all of the programs. We have canceled all facility rentals and reimbursed anyone who had a rental in the next 90 days. And as I said, staff is focused primarily now on response to the emergency. Next page. Engineering. We've been working with the community center contractor and some of our other contractors in response to the emergency. As you know, public works contracts and contractors in construction projects are considered essential currently. However, we have sent a letter to the community center contractor and informed them that although their project is considered essential, we are certainly willing to work with them on a suspension of the contract if they choose to do so. That would not financially harm the contractor nor the city. At this time, my understanding is construction is still going on. However, we know that the electrical subcontractor on the project has decided to suspend work. They were uncomfortable with the situation. So we can't guarantee that that project is going to continue on the same schedule, but again, we will be working with the contractor. For the administration, finance is still doing accounts payable and payroll. Most of that can be done remotely. Only once or twice a week does somebody actually have to go into City Hall to do accounts payable. The staff is also going to be working with the Financial Commission on the 10-year forecast, and we'll be discussing with the Financial Commission the financial implications of what we're currently going through, and there will be some implications involved with it. It really just depends at this point on the length of this emergency. And IT staff are supporting all of our new systems and hardware needed for staff working remotely. They are running as fast as they can, trying to keep up. Next slide. Community development, we've spoken a little bit about community development. We're still processing applications, and we are still trying to take on some of the initiatives that the council has given us, including reach codes and some of the other items. We talked about that earlier with the strategic priorities work plan. We have, due to a lack of critical resources, we are slowing down and now just about suspending all on-site building inspections. The issue there is, frankly, we are simply running out of hand sanitizer and disinfectant wipes, and we can't send our inspectors out unless we know that they're going to be safe. We are hoping to hold a DRC meeting in mid-April, and I believe we're going to try to hold a planning commission meeting in late April, provided that the system that we are now using, like the council is tonight, is working, and it seems to be working pretty well. Next slide. The other important developments, and this is where we are really looking at kind of reallocating what we do and reassessing things. Food distribution, we are working with the Community Service Agency in Silicon Valley Strong. Our main focus right now is on CSA to ensure that our local needs are met, with Silicon Valley Strong kind of acting as a backup and a resource if necessary. We're also encouraging Los Altos residents to volunteer, if possible, with CSA to distribute food to those in need. We will, and I've mentioned this to the staff, that if CSA requires more volunteers, I will work with our department directors to reallocate some of our staff and use city vehicles if necessary to distribute food to those in need in the community. And we are also encouraging on our website for individuals to make donations to CSA during this crisis. And if you have more questions on that, as we get to later, Donna Legge is on this call, and she can certainly supplement what I said. Next screen. Childcare is another area where where Donna has been heavily involved. The key issues here, we're trying to figure out ways to help those in the medical profession and first responders with childcare. My understanding is that the YMCA has now been certified for childcare, and they're taking some children on in there whose parents work at El Camino Hospital. We've also been in communication with the school districts and are working on a plan to get at least one facility in the city, either a school facility or a city facility, to be certified for child care services. I believe that today the school district was to find out if one of theirs was to be certified. And so we are continuing to look at that, and I have told Donna that we are certainly willing to reopen one of our facilities for a child care provider to provide child care services under all of the guidance and regulations associated with the COVID-19 order. Next slide. The business community. We've been in communication with the Chamber of Commerce, LAVA, and the other groups to ensure that information is received by the business community. Our Economic Development Coordinator, Anthony Carnesecca, I know, has been in close contact with Scott Hunter with LAVA, Kim Mosley at the Chamber of Commerce. We are doing everything we can to push out as much information to them as possible, and we will certainly add to all of that the county prohibition on evictions also. Our police department have been in contact with the grocery stores to make sure that there are no issues with deliveries or shopping as the public becomes more in need of certain items. And we are working with Los Altos citizens. This is the Los Altos Strong that I believe Kim Cranston and Kim Mosley both mentioned. They are working on a plan to support local restaurants by compiling data about all the restaurants in Los Altos with information about how to order, their hours, and ways to make everything easier for residents to look up, residents looking to support the local restaurants. So that group is called Los Altos Strong, and we've been working closely with them. Next slide. The communications. We have put together a team from 4 different departments working together on communications. We're trying to keep the community as informed as possible. As all of you know, we have a new public information officer, Sonia Lee. Sonia has been working, I can't imagine how much time, trying to keep our website up to date, trying to make sure that everything that's coming out of our emergency management meetings, which we have almost on a daily basis, is then communicated to the public as we make changes to what we're doing and as we learn of changes from the county health department. We're updating everything through social media as well as our website. And in addition, I should add the local newspaper has actually sat in on one of our emergency management phone calls. I view that as an effort to get more direct communication with the community through the local newspaper. Next slide. And finally, thinking in the long term about what may be going on over the next days, weeks, potentially months, I've been real concerned about the morale of the community. This is, I know how difficult and stressful this is on me and on the staff and on our families. I'm sure the community is all going through very similar stress at this point. So we've put together a small team of staff to kind of work on community morale initiatives. Donna Leahy has kind of taken the lead on this also, and she has reached out to her cohorts in the 2020 LEAD class. This is the group that is headed by Claudia Coleman under the Los Altos Community Foundation, and asked for their assistance with ideas and with implementation. And I believe they're having a conference call in the next couple of days to discuss this. We've also been promoting the Lights of Hope campaign. We are encouraging everyone to put on their outdoor holiday lights as a message of hope to all those during this time. And our maintenance department today turned on the lights, the holiday lights in downtown, including the lights on the palm trees. So that's kind of where we are with everything. As you can imagine, this has been occupying 100% of my time over the past 3 weeks and 100% of many of our staff. And I really do want to take this opportunity to thank the staff, the department directors, the management team, everyone who's been involved. They have been working extremely hard and really focused on what they can do to assist the community during this crisis.